Hello and welcome to our video series, Training at Scale Mastery for the New Patient Experience and Treatment Acceptance. I'm Dr. Paul Homoly. This video series is specifically designed for the leaders, dentists, team members, and trainers within dental support organizations. Its topics will focus on critical distinctions within the practice of dentistry. Once understood and implemented, these distinctions will favorably distinguish your organization in the minds of your patients, your practitioners, and our profession. A distinction that occurred to me early in my career was the one between chief complaint versus the four chiefs. As a senior in dental school, my clinical instructor, Dr. Rice, would tell me, "Homoly, make sure you learn that patient's chief complaint." Even back then, I thought the language chief complaint was off base. Think about it. Learn your patient's chief complaint? Does this make all our new patients complainers? What mindset does that inspire? Wouldn't it be better to recommend learn why your new patients are interested in improving their dental health? Do you feel the positive emotional momentum in that mindset? We know the chief complaint relates to the intraoral condition that brings patients in for dental care, the broken fillings, the discolored front teeth, or the missing teeth. You see, solely focusing on patients' chief complaint may be all right for patients needing only minor care. However, for patients whose needs are more complex, the concept of chief complaint is an inadequate inquiry into patients' concerns. For new complex care patients, it's essential to expand the inquiry beyond the chief complaint. Expand the inquiry to the four chiefs. The four chiefs are the chief condition, chief disability, chief benefit, and chief fit issues. Discovering the four chiefs for the new complex care patient is the objective of the new patient interview. Now, the chief condition is the same as the chief complaint. It's the intraoral condition that brings patients into the dental office. The chief disability it's the negative emotional component of the chief condition. The disability is how the condition interferes with patients' lifestyles. The disability is emotional in nature. It's not in their mouth, it's in their lives. For example, Helen has a chipped front tooth. This is the chief condition. The disability is she's embarrassed about it at work. Now, the chief benefit is always the emotional opposite of the disability. For Helen, the chief benefit is feeling confident at work. The chief fit issues are patients' life circumstances that dentists need to accommodate when recommending care. Fit issues include patients' budgets, work schedules, family issues, and general health concerns. Often it's fit issues that determine a patient's readiness for care. They may want the benefits of care, but if their fit issues don't allow it, treatment may have to wait until care fits into their lives. Discovering complex care patients' four chiefs during the new patient interview only takes a few minutes. I recommend dentists, not team members, have the four chiefs conversation with new patients. It's not that team members can't have the four chiefs conversation, but you see, it's more powerful and influential when dentists lead it. With some practice, the four chiefs conversation takes just a few minutes. It gives dentists much greater insights into their patients and offer patients the experience of being understood. It becomes the first step to liking and trusting their dentist when patients feel understood. When it becomes critical that your organization better fulfills its vision of providing excellent new patient experiences and improved treatment acceptance, my work becomes the perfect companion to fulfill that vision. When you're ready to discover more, consider visiting Training at Scale Mastery. Thanks for listening.